No, no, she is audible. You just change your setting. Can you hear me, Chaitali?
Do I need to use something?
Dr.
Because-
Meghna is perfectly audible. You can rejoin. Acha, Dr.
From my
Meghna,
side, it's not audible.
Dr. Meghna, you continue. I am calling Dr. Chaitali Mondal.
Okay, all right. Yeah, I am Dr. Meghna Motwani. I am the VP of Clinical Research at Nutrova. So I'd just like to start with giving you all a little brief about Nutrova. We are a nutrition company. We started in around 2012, and with the goal that we want to make evidence-based products of a very high quality. So at that point, we weren't trying to play the price game or anything. We just decided that we were going to make the best product which we can give to the consumer and build our following over time, where people will eventually realize that it's a good, they're really good products. And to meet that goal, we also did, as a startup even, we've done almost 3 clinical studies since we have started. And we have also published these clinical studies in some international journals. So on that, I would like to introduce the webinar today, which is Nutrition for Skin and Hair, where we will cover how different nutrients play a role in improving our skin and hair to reduce the effects of aging on our skin and hair, and the effects of external insults that we are constantly bombarded with, like UV rays, pollution, etc. So for doing this, Dr. Chaitali Mondal will be speaking about it. I just want to give a small introduction about her. Dr. Chaitali Mondal has a PhD in nutrition and a fellowship in medical cosmetology for skin and hair. She's also a senior consultant dietitian for weight management, diabetic management, and sports nutrition. So over to you, Dr. Chaitali.
Okay. Hello, everyone. As she already, introduced me. So I am Dr. Chaitali, and today we're gonna talk about certain things which are needed for our skin and hair. For good skin, good hair. Apart from nutritional needs to our body, there are certain things which are equally needed for our body. Like when we start giving diet to patients for weight reduction or weight gain or certain other conditions, our skin started looks dull. You know, patients, they frequently complain about, I have started losing my hair. I have started, my skin gets shagged, it gets dry, and there are no glow in our skin. So as most of us are dietitians or nutritionists here, I guess, right? So apart from a healthy diet, we can give certain things to help them out. Okay. So first thing I'm going to talk about that what are the objectives for this seminar or this webinar. So first thing, to explore the effect of nutrition on skin and hair. Okay. And to demonstrate certain products which can promote healthy skin, hair, and overall health. And to explore how they can add value to our practice. So, Meghna, can you start showing the slides?
Sure.
From slide 3.
Just a second. Opening it up.
Yes. Yes. From slide 3, huh? Yes. So first, we will talk about collagen. Am I audible to everyone?
Yes.
Okay.
Yes, audible.
Okay. So first we need to know what are collagens. So what is collagen? A collagen is a primary building block to our body and the skin, muscles, bones, tendons, ligaments, and other connective tissues. So yeah, that is the thing. So collagen has everything needs collagen to perform or to continue on a proper function of our body. So basically, we all have collagen, and collagen, as it is showing over here, that it is the main thing of our everything. Like here, it is written skin, hair, even gut, bone, and joint. So we need to give collagen to every patient. In our 20s, the collagen is the production is high in our body, but after 20s, we started losing collagen 1% every year. So if you are in 20s and you're after 21, like after 20, like from 21, if you are starting losing collagen from your skin, 1% every year, so you can understand by the age of 40, 50, where we stand. That means we lose more and more collagen. So like this, if this is the inside our skin, particularly on the face, hair, we have collagen. If you have started losing collagen, we can lose skin's elasticity. Even we can lose our hair strength, right? So next slide, please. Meghna, next slide.
Yeah. Yeah.
Okay. So in our skin and hair follicles, it is showing that collagen form the 75% of our skin. Okay. During anagen, means anagen and catagen, you understand. So during the growth stage, our hair cycle, the amount of collagen surrounded in the hair thicken. Means collagen can make our hair thicken strong from the root, from the follicles. Okay. Collagen peptides have been shown to increase the mechanical strength of the hair. As I have said already, if we are having collagen, proper amount of collagen in our skin or in our hair or in our body, then that makes our hair more strong, right? Next slide, please. Okay, same way for our, as I have said already, that it forms for our bones, our tendons. So for the nail bed, okay, for our nail, inside the nail bed, that has got collagen also. So if there are collagen reduction, there is a collagen reduction in our body. So our nails started getting, it getting thin and it can break easily. Next slide, please. And for our bones, it is very much important. Like in normal scenario, we give collagen to our patient 5.5 gram to 6 grams per day to get a proper skin and hair. But for our bone also, it is equally important. But for that reason, we need to give more amount, like more than 7 gram per day. Okay, it's more than 7 gram. So that we have to give to the patient to get a proper healthy and strong bones. Okay, next. Meghna, next.
Yeah. Sorry, my laptop is hung up.
Okay, okay, take your time. Okay. So collagen also present in our muscle. Okay. Ready?
Yes,
Okay.
yes.
Okay. Collagen is also present in our muscle, ligaments, and tendons, as I have said from the beginning. Collagen makes up to 10% of our muscle and 90% of our tendons and ligaments. Okay, like those things which attach our bone and our muscle. Those are ligaments and tendons. So it contains 90% of the tendons and it makes 90% tendons and ligaments, whereas 10% of our muscle. So definitely collagen is very important. Next slide, Meghna. Okay. And the next thing, which is very much important, that is collagen helps to reverse our aging signs. That is very much true. A patient comes to your clinic asking for, ma'am, I know you're a dietitian, so give me certain food through which I can be young. There will be no more, there will very less chance to develop wrinkles. I have to get a very good skin and hair. So being a nutritionist or a dietitian, apart from healthy diet, we can definitely give collagen to them. At least, see, for every patient or for us, it's not possible to perform, Botox. So we can't perform Botox, but at least we can help the patient to give collagen, low molecular weight collagen. So that the patient will feel good. They will get the desired result. So being a dietitian, it is a part of nutraceuticals, it's not a part of pharmaceuticals. So we can give nutraceuticals product, that is collagen or omega-3, anything to help them out. Okay, so aging, what are the factors of aging? Like fast aging. Like first, stress. If you are in too much of stress, for that could be your work related, family related, that impact of our collagen depletion. Collagen started depleting in a faster way. Okay, then poor sleep. You are not getting proper sleep. Maybe you're sleeping for 4 hours, 3 hours, you're not sleeping properly, or else you are getting 8 hours sleep, but that's not a sound sleep. In between the sleep, you are getting too much of stress inside during your sleep are not in a continuous mode. Maybe you're sleeping for 2 hours, in between after that at the midnight around 2 or 3 o'clock you got up, and then you're thinking, okay, I'm having certain issues. Okay, have some water, walk around, then I'll sleep again. So that's not a proper sleep. We need 8 hours proper sleep to get a proper balance in our body. And again, if for improper sleep, poor sleep, again there will be, collagen depletion. Our cells get, irritated. Started to destroy. It start to get destroy our cells, healthy cells. As you can see, there are pictures, healthy cell attacked by free radicals and damaged cell. Our skin will get damaged. Another factor, that is smoking. Women or men, anyone can take collagen. But if you are a smoker and you're a heavy smoker, definitely the collagen depletion will occur in a faster way, because there will be more and more free radicals to our healthy cells, and that can destroy or damage our cells. Okay, then poor diet. Being a dietitian, we always ask our patient not to go for cold drink, sweet, sauces, chocolate, pasty, all this chow mein, rolls, all this thing, or biryani, which is very famous these days. So we as a dietitian, we say our patient, or we instruct our patient not to go for fast food, outside food, or cold drink, all this thing. Better you can eat at your homemade food, right? Because the homemade food is better. If you are taking too much of outside food that contain monosodium glutamate, other colors, metanyl yellow, all these things, that again damage our cells and destroy our cells. Okay, and certain external factors are there. External factors are like pollution, direct exposure to sun. You need to use, umbrella. You need to put some sunscreen, sunblock to your skin, and then go out. And for pollution, again, there will be more production of free radicals to our healthy skin, and that can be damaged. Okay, next slide, Meghna. Meghna, next slide.
Dr. Chaitali, I think my laptop is just hanging up. Can I just ask someone else to
Yes, yes, do it.
Yeah, just give me a minute.
Okay.
Acha, by that
So-
time, if you want to ask any question to Dr. Chaitali,
Yes,
so far she
definitely.
has discussed many things, and very important thing Dr. Chaitali has discussed. So by the time technical glitch is being solved, anyone have any question? Have you ever heard about collagen or the supplementation, or have you ever used it for any of your patient? You can ask. You can feel
Yes.
free to ask in Hindi or Bengali also. We are free to answer in our
Exactly.
local.
If you are having any issues with the language, we can speak in Bengali as well as Hindi. Everyone is, I guess, there. Do you have any question or anything you want to ask?
Joyashree or Paramita or anyone, those who are just started your practice. Do you face this problem? Patients coming with PCOD or patients coming with diabetes, they are saying that I am facing with dry skin. Even they are not 40 even. They are 28, 30. They are telling you
Even skin pigmentations,
skin
there are,
pigmentation,
yes,
Yes,
darkness.
yes, ma'am.
darkness.
Yes,
Yes.
yes,
Then
ma'am.
just switch on your video.
It is a
Yes, Bidisha, you can ask in Bengali or Hindi also.
Yeah, you can ask in Bengali. বলো বাংলায় বলো, আমি বাংলায় উত্তর দেবো, কোনো অসুবিধা নেই।
এটা খুবই হয় যে ওয়েট লসের সাথে স্কিনের একটা গ্লো চলে যায়।
Very good.
এই জিনিসটা কিন্তু আমরা নিজেরাও কখনো বা খুব কাছের কারোর থেকেও এই একই জিনিস শুনতে পাই যে যখনই ডায়েট করছি, এবার সেই ডায়েটের মধ্যে হয় অবশ্যই কিছু লুকস আছে, বাট দ্য থিং ইজ লাইক যে ডায়েট করলে আমার স্কিনের গ্লোটা চলে যায়।
এটা
And
ডায়েট
আমি
করলে
হ্যাঁ,
হ্যাঁ, বলো কোশ্চেনটা বলো বলো।
হ্যাঁ, মানে এটার রিজনটা মানে ম্যাম যে ডায়েট করলে বা কোনোভাবে আমাদের স্কিনের গ্লোটা চলে যাবে। খুব এখন কমনলি আমরা এখন বলিউডের, মানে আমি একটা জাস্ট এক্সাম্পল দিচ্ছি, একজন ডাইরেক্টর, তো তার খুব ওয়েট লস হয়েছে এবং সে বলছে
Bidisha, if you don't mind, many people are from India. If you tell in Hindi.
ওকে
Yeah.
Okay, ma'am, I just wanted to ask you something about the skin glow. And I have a question about that. One of our very popular director in Bollywood, he just reduced the tremendous weight loss. And
Karan
he is
Johar.
having
Karan
a-
Johar.
Karan Johar.
and he is saying that he is taking 1 meal per day.
Hmm.
So
So your
how is it
question is,
possible?
your
Yes,
question
ma'am.
is, if I give weight loss diet to a patient, then patient glamour or glow is going out. Because, and I will not take the name. There is a very popular celebrity dietitian in Kolkata. Even her many patients comes to me and for the same reason, ma'am, we are losing weight. That is okay, but
I agree with Chaitali.
even he knows I'm talking about whom.
Yeah,
At the
I
same
know.
time, I'm feeling so weak. My skin goes, shaggy. I have lost my
Yes, ma'am.
glow and everything. Why, because when you are doing a fast weight loss program, if you are not supporting the patient with certain things, certain vitamins, certain things, then there will be fast and more fast depletion of the collagen. Because collagen is a protein which present inside our skin, hair, bones, tendons, muscles. So, okay, I'm giving a very fast weight loss plan to a patient. At the same time, tell the patient, ma'am or sir, whoever, I'm going to give you certain things which will help you to not lose your strength, your physical strength, your skin, and your hair. So for that, we need to give them very first thing you need to give the patient is collagen. Give collagen and tell them take a proper collagen which molecular weight is very low, because if the low molecular weight, it dissolves in our blood in a faster way, there will be no more bloating, no more constipation, because bloating and constipation are the two adverse effect of taking collagen of high molecular weight. But the brand which we will take the name after some time, that they have very low molecular weight collagen. So if you are giving collagen from the beginning, Or else you can start giving collagen after a month. I don't know in which window you will see your patient. I see my patient every 4 weeks. So after 4 weeks, when I'm giving, when the patient comes with a result, first you have to see the patient is giving any result or not. Patient come with like, I have lost 4 kgs. That means patient is following your diet. On the same time, you have to prescribe. Now start taking collagen every night after your dinner, not, and you will see the change. Even if, trust me, after 3 days, patient is getting very much glow inside the skin. They are saying, ma'am, I feel I'm becoming fair. Actually, it's not the fair, it's the glow. Fairness and glow are the different thing, but because there is more glow to the skin, patient feels good, and they are losing weight at the same time. They are having the very good skin and hair. Okay. And one more thing you need to give to them, that is omega-3 fatty acid, omega-3 fish oil, which again help them to control over inflammation, and that can help to our many major organs to our body. We will discuss about omega-3 later on. Right now we have to stick to the collagen. So at least you can give
Uh, Ma'am,
collagen to
what
the
is the
patients.
recommended part? What is the recommended? Like
That
how
we will
one
discuss
tablet.
later.
Yeah,
That we will
recommendation
discuss
level I
later.
have already discussed. Basically
Okay.
for skin and hair, that is 5.5 to 6 gram, or means 5 to 6 grams per day. Okay,
Okay.
5 to 6 grams per
Okay.
day. And
And
for
ma'am, how long
bones,
we can take it? And how long we can take it, ma'am?
whole life, whole life.
There is no
Because
adverse effect.
yeah, because there are no adverse effect. Okay, because your skin or your body losing collagen every year, 1% every year. So if you are 20 right now, and when you will be 40, that means already 20% collagen you have lost if you're not taking any support. Okay, so we need to take collagen throughout our life, and you will see you feel much more younger. Those who are not taking collagen. Okay, definitely with a proper planned diet.
Diet.
Yeah, diet is very much
So,
important. Being nutrition.
Chaitali, let us back to the presentation. It is again
Yeah.
shared.
Okay.
Thank you, ma'am.
Next slide, please.
Ma'am, is there the only supplemented thing for nutraceutical we should use for the collagen, or is there any kind of dietary things we
Excellent.
can do?
Excellent. Your
We will discuss later, Shukriti.
yeah.
I will remember the question. Chaitali will take it later after
Okay.
finishing the presentation.
Exactly, exactly. So now we'll talk about aging and collagen. See, as I have told you, collagen present in our body and in most of the things like skin, hair, and everywhere. So aging in all tissues. So for skin, we have 70 to 75% collagen. They're, see, these things I'm just discussing. You don't have to, remember all these things. So these are the things which we need to discuss. Okay. For fascia, 90% or collagen, ligaments, 90% collagen, bones, 30% means through collagen, it made of this much of collagen. That is the thing that we are discussing. The jaw recesses and the eye socket, viris and nose drop, etc. Means every part of the thing you are having collagen. When there are collagen depletion, see, youthful face and aging face. See the difference about in the two pictures. Look at it. Then in first picture, the first skeleton picture above where it is written the youthful face, and then inside the eye means fascia and everywhere. See the difference. And if you are having the younger age, like around 20s, but if a patient is not taking collagen, not taking any support, so after maybe 20 years, look at the face. See, there are differences. Inside eye, there are shagging, here from the eye, there are shagging in our skin, and it looks shrunken, and it's not looking healthy. Is it looking healthy to everyone? Reply,
No,
please.
ma'am.
It's not looking healthy
No.
because they are not taking the support. So it's our responsibility to give collagen to patients so that they can feel healthy. They will say, okay, ma'am, or not only give me a proper balanced diet, but along with that, she gave me a proper support to maintain my overall body. Okay, collagen. After getting the collagen, na patient will thank you, ma'am. You have given me something through which I'm having a very good, overall performance, overall looks. I gave collagen to most of my patients by saying all this. And after having one full course. One full course is like 130 days. Like 30 days. So after 30 days, when they come back to me, when they come back, ma'am, please give me the collagen again. I want to continue, which is very good. You know. Okay, the next slide. Actually,
I have a
next slide.
question.
Okay.
I have a question regarding the
Question can we
eye
take
shrinking.
later,
Can we
please.
take the questions later on?
Question will be at the
After,
later.
Yeah,
It is
after finishing
a
the collagen,
webinar.
after
It is a
finishing the
webinar.
collagen chapter, we will answer all the questions. Is that okay for everyone?
Yes, it will be
sure.
okay now. Otherwise, too
Well,
many interruption will just
will
interrupt the flow of the
interrupt the
session.
flow, right? So, Meghna, or we were running the slide, please.
Next.
Next to next, next. This they don't want to. So absorption, do they need absorption of the collagen? I guess we should move on to the next slide. Okay. Where is the next slide? Just pass on. Okay. No. The absorption of collagen peptide, there are certain articles.
Yes, it is now visible. The absorption collagen peptide.
Yeah, exactly.
PubMed.
See,
Yes.
there are so many, researches or RCTs which are published in PubMed. PubMed is a very popular place where, which is believable or which is very much scientific. So PubMed has shown certain research that oral consumption of collagen is how much effective. Okay, so human studies shows that they are found in the bloodstream of 1 or 2 hours post oral consumption. I mean, if you are consuming collagen like 5.5 or 6 grams, whatever, with normal or cold water after your dinner, as soon as finish your dinner, then just have it. Then after 1 or 2 hours, the collagen will be available in our skin and for the absorption. So you can read the studies like identification of food divert collagen peptide in human bloods after oral ingestion and gelatin hydrolysis. Means they are very much available for our body. See, this is one study. If you want to click a picture and need to read more about all these studies, you can click the picture and go to PubMed and you can get the full, the full thesis, or not the full thesis, at least the certain information. And there is one more study, that is comparison of quality and structure of hydroproline and contractive peptide human blood after oral ingestion of gelatin hydrolysis from the different sources. From the different source, how can we get this collagen and all? So just click the picture and you can study more about the collagen, because these are the thesis papers or the researches which are available in PubMed. Okay. Okay, next, intact absorption collagen peptide. I don't think so it is needed. Shushoban? Shushoban, sorry. So, it is needed. Okay.
No, ma'am. You can
It's
continue.
not needed. It's not needed. Okay. Okay, now come to this slide. How do collagen peptides differ from dietary protein? So we can say, we can ask, ma'am, we are taking, chicken, egg.
Yes.
If we are vegetarian, we are taking, if we are for vegetarian, we're having dal.
Somebody was asking this question only, Chaitali, few minutes back. যে
Okay.
dietary source থেকে আমরা পাবো কিনা, and এটা
Exactly.
difference টা কি, you will get the answer now. Okay.
Now, you'll get the answer now. So like we are having egg, chicken, fish every day. Or if you are a vegetarian, you are having, curd, milk, paneer, dal every day. So, or soya chunks, everything. So we are having protein, and collagen is a protein already. So can't we get the thing from our normal diet? So the thing is that no, we are not able to take it from or bring it out from the normal diet as much as it is required for our body. That is the thing. The amount we are required for the body, we are not getting from all this kind of protein which we are cooking and eating every day. Right? Why? Because dietary protein provides all the amino acids. That is true. Okay, high level. Collagen peptide provide a more targeted approach for the accelerated collagen production. Okay. And the bioactive nature is why they work on the chronic wounds. Both are beneficial. Okay. Both are beneficial. But there is again a study. Scientific amount of the functional collagen peptide can be incorporated in the diet while maintaining indispensable amino acid balance. Okay. You want to say more about Shoma?
No. It's done. It's good.
It's done, right? So,
Dr. Chaitali, sorry,
hmm,
can I just intervene 1 second? Someone asked a question, what is the difference between collagen and gelatin?
hmm,
So I would just like to mention that
hmm.
collagen is the protein that is found in our body.
After absorption or after digestion, it changes. Okay, say.
So gelatin is when it's denatured collagen, and collagen peptides are made from that gelatin.
Okay,
True.
so if it is get destroyed or hydrolyzed, then it forms gelatin form. It's like a
Yeah.
jelly kind of thing.
Actually, it is the degraded form of collagen.
Yes.
Yeah,
Gelatin is-
degraded form. Okay. Biodistribution of collagen peptide. Do we need it? Change the slide, please.
No, these are not required.
Because that will be more and more in depth.
More in depth.
So that is,
Anytime, if you want, the students are interested, we can do some
and
advanced
we
class.
can go for certain,
Yeah.
yeah.
But today we will discuss the basics.
Basics. First, we go for the basics. Then, if you want, we can go for in-depth discussion of the orders, because there are a lot of very not too many nutritionists or dietitians. Na? We need to know why we will going to prescribe collagen or any other important nutrients to them. That is the main thing. So, basic information we need to understand. Why? Okay, collagen peptides and wound healing. Are collagen peptides able to help in the wound healing? So collagen breakdown products can modulate the wound microenvironment at different stage of the wound healing. Definitely, they help in our wound healing. That is the main. If you are having a surgery, post surgery, it could be inflammation or something. So if you are giving collagen to those patients, then they will get help to get faster wound healing. Acha, there is a question because it's a huge time, so a lot more time gone, and you people are not, talking. So I'm going to ask. So give me one name of one vitamin which help in wound healing as well. Can anyone tell?
Vitamin C.
Very good. Vitamin C. So vitamin C helps in our wound healing, but there are lot more patients. They think after surgery we should not having
Sour
lying
food, talk khabo
khatta
na.
or sour foods, because that will again, what would happen, there will be pus formation, inflammation if they are taking vitamin C, means lime or musambi or anything that sort of. Thank God they don't know about the chilies. The chilies do, green chilies, they do have vitamin C, but so it's our responsibility to give proper education to the patient. No, you have to go for vitamin C, because that will help you to heal your wound faster. And definitely, as today's class is about collagen, so collagen is definitely help in the wound healing. We need to suggest any patient who has gone for any surgery, so we need to give them collagen to get faster recovery. Okay, because more 90% of our skin is made of what? Collagen, right? Next slide. So age and collagen. So as we are getting age and we are aging, and if we are not having proper collagen, the amount of collagen which is needed for our body, definitely see the next picture. Collagen degradation is getting higher and collagen production is getting lower, because as you have said, 1% every year after 20 years we lose collagen. Okay, next. So collagen peptide supplements, what to look out for? As I've told you during this conversation, that low molecular weight collagen can be available to our bloodstream as, as soon as possible. Where if you are having high molecular weight collagen, that can cause bloating, constipation, and that will take huge time to available to our bloodstream. Okay, so average molecular weight as shows 5 or less than 5 shows a good amount of DI and tripeptides. At least 5 gram dose per serving of collagen peptides. As I've told you, but it depends between 5 to 6 grams of collagen per day we need to have through through supplementation. Okay. A published clinical study on Inform that shows that safety and efficacy on our information are supplied study and have metal testing like third-party labs ensure safety. By doing the metal, by doing a lab test, they have shown it is safe if you are having low molecular weight collagen. Okay, next slide, please. Uh, Obviously, we need to, before having anything, any supplementation or anything, we need to see the grants. Okay, that they have all the necessary grants so that only we can trust the product. That is GMP and FSSI certification. I guess here all of us knows about this, that all these things needs to be there, all these grants, right? And added antioxidants are there or not. So definitely added antioxidants can help uh, our collagen to easily, get available to our bloodstream, and antioxidant helps to prevent many diseases, right? Okay, next slide, please. Uh, So what are the things, but why we need antioxidants? Because antioxidant neutralize free radicals. As I have said, due to pollution or due to stress, smoking or less sleep, inside the healthy cells, free radicals forms. And those free radicals can damage the healthy cell. So if we are having a collagen along with antioxidant, means the antioxidant present inside the collagen, what they will help? They will help to neutralize the free radicals. When there will be a no formation of free radicals. And vitamin C and E, which again help to, vitamin C helps in our wound healing. Our skin looks better, and vitamin E again responsible for overall like skin and hair health. Okay. And phytonutrients from the plant food means nutrients or important things which comes from the plant source, right? Like, can you name one phytonutrient? Anyone? Yes.
Ma'am,
She has
flavonoid.
already shown. She has already shown it. Anyone?
Ma'am, flavonoid.
Okay. One more.
Flavonoids, polyphenol, xanthine, tannin.
Alkaloids.
Very good. So all these things are phytochemical or phytonutrients, which are helpful for our skin. Okay, now we are going for the next slide. Skin and antioxidant, it's done. The next is skin and antioxidants. No, no, no. Come before. Yes. So skin and antioxidants, like for example of carotenoids, like just now actually I have told you, na, she already shown. Okay. What are they do? They are strong antioxidants, carotenoids. Can anyone tell from where we can found carotenoids?
Carrot, any colorful
Any
vegetable,
yellow or orange colored
Orange color
Yellow
vegetables
orange
vegetables, right?
pigment.
Very
or
good.
fruits.
So that the name itself suggests na carotene, they are carotenoids. So carrot comes for currant, pumpkin, all these things. So they are very strong antioxidants. They absorb UV lights. They absorb UV lights. They give skin a healthy appearance and glow. So if you are saying, ma'am, so antioxidants, so we can have carrots every day, but how much carrot you can have or how much pumpkin you can have every day? Right. So we need, if we are adding antioxidants to our collagen, so that is a healthy and as compact thing that has got vitamins, antioxidants, and so we are having the supplementation every day. Our skin looks better and better day by day. See, there is a picture which shows the melanin, skin looks brighter and brighter. See, have a look to the picture. Then the next slide. Kerashield is a product which is from Nutrova. They suggest, so if you are having Kerashield, so your skin will not get affected by the UV rays. But it doesn't mean that you don't have to apply sunscreen. Sunscreen you need to apply. This is an oral consumption kind of thing. If you are having it orally, or if you are giving this medicine to the patients, so they are getting overall protection from the outside and from the inside. So if there are any UV rays, reach to our body, they can neutralize it. So that is the Kerashield which they have, the brand called Nutrova. Okay, next slide, please. Okay, lycopene and skin and hair. So where is the lycopene present? They have already shown the picture, that is tomatoes and everything. So this is again helpful for our skin. We generally give to our patients have tomatoes, or we eat tomatoes every day. So that can help to get lycopene to our body, which is again helpful for our healthy skin and healthy hair. Next slide, please. We don't need it. Go to the next. Next. Okay, there are certain clinical studies on Nutrova, collagen, and antioxidants. Now you can understand we are talking about a particular brand called Nutrova. There are certain other brands are available. Lot of brands are available. Okay, I can name them. Even one is very much popular in internet, not internet. In people, like it is available in many where. That is Oziva. Okay, but if you are giving Oziva, if you are having Oziva, you can understand. If you are after taking 2 days, 2 consecutive days, you will say no, please, I will not going to have Oziva. I'm not enemy to Oziva. Okay, but I have consumed it practically. After having Oziva, this collagen, I have got severe constipation, severe bloating. Throughout the day, I don't feel like to eat anything. And that is because that has got huge or more. Molecular weight is more. And maybe some of the patients, they have tried also. Right now, you won't see the people are having this Oziva. People are having those collagen which has got very low molecular weight. So low molecular weight collagen is very much prescribable for the patient. So Nutrova is a brand who has got this kind of collagen, which has got very low molecular weight collagen, along with antioxidants, along with vitamins, which is very much available for our body after consumption. There will be no more bloating, no more constipation, or, I don't feel like to eat. No, nothing like that. You can follow it. You can eat in a normal way, in normal interval, a balanced diet. Fine. So, what Nutrova collagen, if you are taking it for 30 days, what they will help? If you are taking it for 60 days, what will help? So, reduction in for 30 days, you can see the reduction in wrinkle width. Means if there are wrinkles, you will see that gradually the wrinkle goes, lighter. It becoming lighter. Skin roughness, yes, definitely skin roughness will recover. I have said my patients, they are feeling very good after consumption of 3 days. After 3 days only, they are, calling me and responding me, ma'am, my skin looks very, glossy, very much, good. There are very, my roughness is getting reduced. I'm feeling good. What are the, and there is a reduction in pigmented spots. Means if they are having black patches, I'm not talking about melasma. Melasma is very severe dark patches. No, but if have you seen those patients? They are having little dark patches. Even there are certain patients have monkey mouth kind. Monkey mouth doesn't mean a monkey. Means apart from other face, this portion is darker. Okay, so that is what that we call the monkey mouth. So if you are having collagen, or if our patient is having collagen every night after dinner, for next 30 days, they can see visible spot reduction. And it is not just I'm saying, I have seen it on my patients. I have thousands of my patients who are having this collagen and they have got huge health. And what they increase? The skin firmness. Skin will feel firm, very good. Skin elasticity will improve. But it means there will be no more shagging. And if a patient already, then after 30 days, patient come to you and they have, I'm getting very good result and I want to continue. So after 2 months, you can see that patients, that that will happen. Reduction in water loss means skin will lose more, less water, when skin will feel hydrated. Dark circles will definitely reduce, because dark circle which forms, not formed in a one night, that take time to form. And so dark circle with, the reduction in dark circle needs more and more time. So after not only 30 days they can see little bit difference, but after 60 days they can see huge difference in dark circle. There will be a reduction in dark circle. Pore sizes, skin has pores, so pore sizes will reduce by using the collagen for 60 days. And definitely, as I have said, skin will feel hydrated. That is the main plus point. Okay.
Please go to the previous slide. I just want to tell everyone, you can take a screenshot. In the right side, you can get a QR code, right? You can get the abstract which is published in, I think, JCD Journal of Cosmetology.
Right,
so
right.
you can access this journal. So you take this screenshot.
See, more, if you want to study more and more RCDs and journal and case studies, you can find lot more information. If
And
patients will
confidence.
ask you, and confidence, because you're confident enough, you know things very well, so you will feel very much confident enough to answer them. Why, ma'am? Why I'm going to take collagen? What is the special? Why antioxidants are there? Do you have any proof that this collagen will help me? Are you sure? Then you can, if you have already handled with all those, research papers,
Journals, research papers.
RCTs, then you will say, yeah, I do have. I'm going to send you the link. You can go through it and let me know. It's not like I'm going to sell the product, so I'm just pushing it to you. No, because you need it, so I'm prescribing it. If you don't want to need it, it doesn't make any difference to me. Okay, as because I have prescribed it for your good, your wellness, right? So the next slide. Okay. Indians clinical study on Indian population. I'm not going to talk about it. Essential fats and inflammations. See, first let me tell you, I am going to go through with all these things, but for essential fats, for there are certain more things we will discuss after this slide presentation. Okay. So
In the
for
panel
basics,
discussion.
yeah, in a panel discussion. But now, no, come back to the previous slides. Yeah, thank you. So essential fats and inflammations. So as essential fats are mainly, what are the things? The omega-3 fat, omega-6 fats. We have already studied all these things from our, graduation level, even even from our 11, 12. So there are two kinds of omegas, omega-3 fatty acid, omega-6 fatty acids. All these things help to control over the
Can you hear
inflammations.
her? I think she lost connection.
Who? Hello?
Yeah, now we can hear you.
No. So there are two kinds of fatty acids through omega-3, omega-6. All these two help to control over our inflammation. Okay. They can reduce inflammation to throughout our body. Okay. Next. Essential fat and inflammation is there. Again, inflammation is the response of the body of infection or damage, obviously. What are inflammations? If there is infection or any damage to our body, that inflammation is not a disease. Inflammation is a symptom. Okay. Then there will be inflammation. You can see the inflammation. So normally it is protective, and when necessary, it harm healthy tissues. Okay. So inflammation can cause damage to our tissues, healthy tissues. To to overcome with this inflammation, what we suggest to give to the patient. Go to the next slide. Means in which sources we can provide omega-3 to the patient, omega-6 to the patients. First, fatty fish. That is a very fatty fish which has got more and more omega-3. And these fishes are not available in ponds or in our local. The amount of fat, with the like cold water fishes or in marine fishes, it is available. Mostly the high amount of omega-3 is available. Can anyone say in which fish the high amount of omega-3 available? Anyone?
In
Except
sardine cod,
sorry?
sardine cod, mackerel,
Yeah, sardine.
or
No, not
mackerel.
mackerel. And I have asked you to have
Mackerel.
more. That
Salmon.
is
Salmon.
salmon. That is
Sal-
the salmon. And in India or in Bengal, there is a fish which is very much popular. In which fish it is available?
Ilish.
Anyone?
Ma'am, Ilish.
Ilish, yeah,
Ilsa.
Ilsa. The Ilsa fish, which is available in Bengal for like 3 months, I guess 2 months. Huh. So that fish has got huge amount of omega-3. But so we are not able to eat, Ilsa fish every day or 365 days in a year. So that's why we need the supplementation that we'll talk about later. But except the fatty fish, that means what are the fishes? The salmon, sardine, mackerel, ilsa, all these fishes have huge amount of omega-3, but the mostly huge amount present in uh, uh, salmon fish. And after that, ilsa. And there are certain seeds which contain omega-3 like flax seed, chia seed, walnuts. They have little amount of, they have decent amount of omega-3 as well. But how much, chia seeds or omega-3 will gonna have? Right, there is a restriction of having seeds and all. If you are having like uric acid problem, if a patient is having uric acid, higher level of uric acid, so in that case you can't give them flaxseed, chia seed. Can we able to give them seeds? No, seeds are restricted in those cases. Then we can give them either this fatty fishes or the supplementation. And definitely walnut is having omega-3. In which sources omega-6 fats are available? Like certain vegetables and seeds oils. Okay, go for the next slide, please. We don't need this or this. Okay, now we are going to the next slide. Yeah. So what are the Neutrova omega-3 products which we can prescribe? Again, I'm telling you, there are a lot more brands are available. They are very expensive. And the first and foremost things, they are not clinical products. Okay, they are not clinical. So when we are suggesting one product to certain patients, we need to have clinical studies that makes them clinical products, not like muscle blaze or something. All these non-clinical brands are available. They are giving those products which are not going to help you in that format. And first and foremost thing, we can't write them in our prescription or in our diet chart, as they are not clinical products. So Nutrova has two kinds of omega-3s, one in veg form. The left side here, as you can see, they are the batch form of collagen. So if you are having patient, they are 100% vegetarian, and you cannot able to counsel the patient down. You go for the non-veg source of omega-3, then give them the veg omega-3, which is again very much effective. Okay. And then we have the main omega-3, which I write to my patients in a huge amount. That is Nutrova omega-3 fish oil, which has got a very pure form of salmon oil. Okay. Why we give, omega-3 to every patient, as we have already discussed. Later on, there will be a panel discussion on this, and then we will understand why it is very much important. If you are asking me, ma'am, for your practice, to how many patients you give this fish oil, so I can tell you, it is transcripted, it is showing. What is this? Okay. So I can tell you 90% of my patients are having this omega-3 fish oil because it has a potential to reduce the inflammation of the body, and Nutrova fish oil can be given to the 100% of the patient because it can give help or it can work on the all sort of patient. Even the patient is hypertensive, diabetic, if the patient is having lot more other things also, you can suggest them, especially for the heart patients. Nutrova fish oil is very important. Means omega-3 fish oil is very much important. Okay, next slide, please. Fish oil supplements, what to look out for. Uh, I guess during panel discussion, we will discuss about all this. So right now, I'm not going to talk about it. Okay. Again, the Nutrova, next slide. Again, the Nutrova fish oil, the purity question, the fish oil one. So more than 80% purity, it has got having.
Yeah,
Okay.
Pathalam, linked.
Which one?
Sorry, Chaitali, you continue.
Okay. Take care. Go for the next slide. Next slide. So they have one more product called Melatase, which has been introduced, I think, 6 or 8 months back. Shushobon?
No. It's just launched 2.5 months back. Okay.
Yes,
So
last month they
No.
came to.
No. It came to me, I guess, 3 months back. Because
right.
they already gave to the two patients. I have giving to the patients.
Yes, 3
They
months
have
back.
continued by third month. 2 months back,
Yes.
minimum to 2 months back.
2.5 months or 3 months, ma'am?
Yeah, 3 months back. So when this Melatase and the another Kerastrength, so anyways, so Melatase launched, they came to me for Melatase is mainly for the melasma patients. Means patients which have a huge dark spots, like it's not one, it's a huge one. And it's like their face looks very, darkish because of the melasma. So mainly this Nutrova Melatase is helpful for melasma patients, and they said it like in that way. So I have certain procedures in my clinic. I do peel, I do skin treatments. So I got interested and I gave to the patient what happened. So for melasma reduction, it has got very good result. But along with that, me and our very senior dietitian, Susmita Chattopadhay, we too give, because Susmita, she said it first. Chaitali, it has got very good function on insulin resistance. So what is insulin resistance? If there is, it has got very good result on insulin resistance, means we can use it for diabetic patient, for type 2 diabetic patient, not for the type 1. For type 2 diabetic patients, they are getting this insulin resistance problem. That's why they are having type 2 diabetes. So Didi first, said it to me, Ms. Sushmita Di, that, it has a very good effect. And after hearing that from her mouth, I gave this Melatase to many patients who are, severely diabetic, uncontrolled diabetes, having, HbA1c more than 12. Some patients have more than 11. And after a month, they have got drastic change in their fasting and PP sugar. See, HbA1c cannot be performed every month. HbA1c can be performed after every 3 months. So I'm waiting for the HbA1c report as well. So after 3 months of taking collagen, I will ask them to do the HbA1c. But for PP, we have got very good, results. PP at fasting sugar patients. So for insulin resistance also, it has got very good results. Later, Shushmita Di will say about it. Okay, micronutrients for hair health. So what are the things which are needed for our good hair and hair health? First thing is collagen, as I have said, the collagen has very good effect on our healthy skin, healthy hair, bones, ligaments, all this thing. But apart from that, we need certain more things to get a very good and healthy, strong, thickened hair. So hair follicle cells are some of the fastest growing cells in the human body. That we know. The hair grows very fast. Therefore, they need vitamins, minerals. Definitely, we do need vitamin minerals like iodine. Iodine, systemic effect, example like iodine, which is required for thyroid hormone production, affect hair follicle cells and hair pigmentation. Okay. And non-iodized healthy salt is being used. Fine. So they have a product which is very helpful for our hair or any patient's hair. If a patient is asking or they keep on telling you that, ma'am, after following the diet, I am having hair fall. Okay. And the patient is not able to take collagen as collagen has certain price, but or they have the patient is not obese. The patient came to you for certain other reason. Okay, like for diabetes or like for other reasons they came, or just to make it a balanced diet plan. Just, ma'am, give me a balanced diet plan. I need to follow it. So, and patient is telling you, ma'am, I have got huge, hair loss problem. Can you give me certain things which can help me? Definitely, you will give diet rich with vitamins and minerals. Definitely, you will give. But definitely, there is a loop, there is a gap. No matter how much vitamin, mineral rich food, practical food you are giving, but you need to give her a certain supplementation or certain thing which they can have and they will get help. Okay. Next slide, please. Next slide. Okay. So this Nutrova brand, they have one nutraceutical product that is called Kerastrength. And I have been using Kerastrength to my patients for like more than a year or more than a year or maybe 1 year, 1.5 years. And patients are getting very good result. To because they are getting healthier follicle, hair grows faster way and hair becoming thicker. But one thing you need to understand, if you are giving you have whenever you are giving this Kerastrength to the patient, and don't commit then after a month you will get huge hair gain. No, you need to tell them, ma'am, you need to continue the balanced diet and the Kerastrength to at least 6 to 9 months to see a visible effect. At the beginning, they can find a baby hair. You understand baby hair? So it's a patla hair like this. So that baby hair that could be formed. It can be visible after 4 months. After 4 months, they can see the baby hair because that they are growing. But the baby hair, we need to give the strength, and to make it thicker, we need more time. So ensure your patients, ma'am, you need to continue this for at least 6 to 9 months to see a visible result. Not like one night miracle. It is not gonna help you out. Okay, aesthetic treatments. These are aesthetic treatments. So aesthetic treatment needs time. It's not a PC Sarkar magic that, okay, I'm doing it and you will see hair growth in the very next day. No, even the patients who are getting other hair treatments like PRP, mesotherapy, and all, which I do to the patient, I tell them straight away, ma'am or sir, you need to continue this treatment for 9 to 12 months, and after that, you can see a very good result. So it's not like after a month, ma'am, where is my hair? I'm having Kerastrength or I'm having this treatment. No, that's not gonna help you out. So being a dietitian and nutritionist, you can obviously prescribe this Nutrova Kerastrength to your patient. There are many dietitians and nutritionists throughout the India. They are also prescribing and they are getting very good results. Isn't it, Shushoban?
Yes, ma'am, definitely.
Hmm. So now we are going to talk about protein for skin and hair. So main structural component, requirement post infection stress. So minimum zero. That see this slide actually now we all know already how much protein our body needs a day. I guess if I'm not telling it, if I change the slide also, they will say. It is very much written for the normal cases, 1 gram, 0.8 to 1 gram, you have written, but 1 gram per kg of body weight. Suppose if you are having 50 kg weight, that means your protein requirement is 50 grams. Isn't it? Shushabon. No, sorry. Yeah. Souvik.
I think
Okay.
Souvik is traveling. Okay.
Souvik is traveling. Okay. You said it is very much. We know. All of us we know. Okay. 68% Indians don't get enough protein. That is very much true. Because see, as I have told you, even you, we all know this problem. 1 gram per kg. So I just now we have said what 50. If you are if you are 50 kg, so you need to have 50 gram protein. So if and in village, even in our cities also. Okay, ma'am said 50 gram protein is enough. So okay, give them one fish or one egg or 2 piece chicken. That is whole day's protein requirement done. No, that is the main case that we have to explain that, ma'am or sir, if you are having 100 gram fish, you will hardly get 20 to 22 grams of protein. Means in 100 gram we are getting this much of protein only. So by giving one piece fish, your protein demand doesn't over. So that we all know, all of us we know over here. Let's not talk about this slide anymore, right? Is that okay? Go for the next slide. Okay, I'm not going to talk about the skin and hair and as they have one fiber. I don't have much knowledge about this fiber because I have never prescribed it, but fibers are always good for our, healthy gut, because everything starts from our gut. If we have a healthy gut, we can able to maintain a balance, balance weight or our ideal body weight. If our gut is problematic, we have many problems. Have our hair problem, skin problem, digestion problem. So they have one gut. So they have one fiber. It is mentioned over here. Okay. Go for the next slide. Okay. So
This is, I think, the last one.
this is the last one. There is one thing that is called magnesium. So magnesium for skin and hair. Magnesium is very much helpful for many things, and the detailed discussion about magnesium will be discussed by our senior dietitian Susmita Chattopadhay, or our favorite Susmita D. So they have one product called magnesium D3, where the D3 amount is very much low. So just to maintain, because magnesium function will boost if there is a presence of vitamin D3, right? So that's why they have a product called magnesium D3, which is very much helpful for many conditions which we deal everyday patient, right? To our patient, we get many patients with this kind of things. So I even even
Soumyendu.
Dt.Soumyendu, everyone. We prescribe this product to most of our patients to get very good and desirable results. Okay. So after that, this is my portion of part. After that, we will go for our panel discussion. Before that, anyone have any question regarding mainly collagen?
We will take the question at the end.
We will take the question
people
at the
are
end.
leaving because of Sunday. Many people, more than 100 people joined, and now they started leaving. It was really a very insightful discussion, Chaitali, and it cannot be covered within 1 hour. So I request the host to share the screen for the panelist, and then
now I guess our very senior dietitian, Madam Susmita Chattopadhay, she will take the screen and she will start discussing the facts.
Okay.
Madam, you just like to introduce Dr. Susmita Chatterjee from your side.
Okay. So, Susmita Di, being a very senior dietitian, okay, and a very helpful life coach, she specialized in clinical nutrition and dietetics. She is a PG and diabetic educator. She's a very popular diabetic educator, certified in as a coach of psychological health. Okay, so she has work experience more than 22 years, and that's why I'm telling her, because she's a very senior among us. So
Sushmita,
now,
are you there?
Sushmita, Now,
Yeah.
Susmita Goody, and she worked with very popular and very good brands as well, and in the hospitals. Now, Susmita, they will take the conversation. Susmita, please come.
Hello, very good afternoon to all of my colleagues and to all of my juniors and my other doctors. Actually, I
Okay.
used to, in my practice.
Didi, can you tell me
Acha,
what is your?
they will stop sharing the screen. Chaitali, you just give the other our introduction in one line, then they will stop sharing the screen.
That would be better, sir. I think you just, ma'am, you introduce all the panelists over there.
Okay,
So
okay. We have total 3 panelists.
Can you
Okay.
go to the next slide, please?
Yeah. Go to the next slide. So next is Soumyendu Ghosh. He's again a very popular senior dietitian. Okay, and diabetic educator. He has a very he has more than 18 years of experience in this dietetic field, and he worked with many popular from nutraceutical or pharmaceutical companies as well. He has his own educational institute where many students who have already got passed out from MSc and all, but in the for the practical knowledge how to make diet chart and all, they visit their institute. That is called Cognize Nutrition. Okay, go to the next slide. And our final panelist, whose name is dietitian Souvik Chakraborty. He is a PhD, fellow who is doing PhD, but at the same time, he did MSc in nutrition, and he's working with, Indian Army hospital. Indian Army, he's in a hospital. He is specialized in sports nutrition and many other things. So with this, now we can start our conversation, I guess.
Very good afternoon to all of you. Actually, in my practice, I used to recommend mellitus as well as magnesium D3. My area of interest is polycystic ovary as well as diabetes, obesity, and GDM patient. So, when I practice with my polycystic ovary patients, most of them polycystic ovary patients, are characterized by hormonal imbalance and insulin resistance.
Right.
Along with that, they have very poor sleep hygiene, which is actually affect their gut health as well as their stress level. So when I get this magnesium D3 supplement, I use the supplement I recommend the supplement for my PCO patient, and I have got a huge result because all of them, as in their teenage, after 18, after 20, they become very stressed with little things. And what happened during the stress level, they have higher level of cortisol. Cortisol is actually one of the predisposing factor of insulin resistance. So if we can bring down the cortisol level, if we can bring down the stress level, I think it will be very helpful to to reduce the insulin resistance. Insulin resistance means the insulin is there, but insulin cannot work functioning properly. So that their weight is increasing. Not only that, their androgen is increasing means testosterone level is increasing. So these are all interplay of the hormones. Okay. So I have given a magnesium D3 for my PCO patient, and they are really very much helpful for them for the sleepless night. They used to always scrolling their mobiles and all this thing. They at 2 o'clock, and they used to get up at 11 o'clock. But all the sleep hygiene or the sleep circadian cycle is completely messed up with this polycystic ovary patient. So to bring down in that cycle, proper circadian cycle, we need sleep hygiene to maintain a proper sleep hygiene. And for that, magnesium D3 is really very helpful. We know that we get magnesium from from our diet, but that is not sufficient to maintain our RDA. So they contain only the 100 mg along with D3 with 600 IU, and that is very flexible. That is very recommendable for my PCO patients. That is, and they are giving in magnesium in form of magnesium bisglycinate, which is absorption is very high. So I would prefer always give magnesium D3 for my PCO patient, and who is also always complaining about stress and all this stuff. This is really help them to reduce their stress level, because patients are appreciating this product. After they're using this product, I don't feel like sleepy all the time. I'm not feeling fatigue all the time. The polycystic ovary patient, as because they are insulin resistant, insulins are more, but they cannot use insulin. So they are all the time, they are complaining that they are feeling fatigue. Even after having sleep, they are saying that no, I am feeling sleepy throughout my day. But after that, having this magnesium D3, they are saying that no, that sleepy, that feeling of fatigueness, feeling of sleepy all the time, that is gone. That is a beautiful, effect of having magnesium D3 from Nutrova. Another product I used to use, that is Melates.
Melates.
Yeah.
As I've told already, you guys, that me and Susmita is the first person who called me and said, Chaitali, it has got tremendous result on insulin resistance. You should try. Then I started giving to the diabetic patient as well. Okay, Didi, go ahead.
In the other country, when they are treating pre-diabetic patients, they are treating with insulin resistant patient, metabolic syndrome patient, they never give initially they don't give metformin. They used to give them antioxidant therapy. In that context, Melates is really very helpful, because it contains very helpful, because it contains magical content of magical antioxidant. It means alpha lipoic acid, which is actually is a powerful antioxidant, primarily works by scavenging the free radicals, free radicals, and regenerating other antioxidants. It also interferes with metabolic process by activating AMPK pathway, to enhancing the insulin sensitivity. So it is very helpful for the patient who have got polycystic ovary and have a clinical symptoms of acanthosis nigricans. It means insulin resistance along with fatty liver, right?
Exactly.
So it is very helpful for them. And I can join also one of my patient. I have given my patient, and she just before I start my the session, I have called her up and I asked her what is the efficacy of how do you find this product. She said it's a miraculous product. I don't feel sleepy. I don't feel like all my black patches which you have seen in the neckline, that has gone, madam.
Right.
I used to discuss with Chaitali, right? And my inflammation, when anyone can see, even he is not a a layman, they used to say you have got inflammation issue. But now if she's living in Bangalore, so she said, ma'am, if you see now, you can understand the inflammation part has gone.
Right. It has got very good effect on inflammation.
That is a beautiful, because as we know that diabetes and polycystic ovary and all other metabolic syndrome are inflammatory disease, right? If we can bring down the inflammation, the half work is done.
Exactly.
Half work is done. Not only the alpha lipoic acid, it contains vitamin C, antioxidant, vitamin D, D3, vitamin E, zinc, copper, and copper. And we know that in treating the fatty liver patient, we used to give, doctors are giving vitamin E supplementation, right?
Exactly. Yes.
So not only for the skin patient, not only for the acanthosis patient, I also prefer to give Melates for my fatty liver patient also, because that is also characterized by insulin resistance. Ultimately, they get back to they go into the diabetic zone. So it's better to come there, right, Chaitali? And
Yes,
you is also agree with this point, because fatty liver is it's an inflammatory disease, is as well as insulin resistant, and fatty liver and polycystic ovary is the same, and as well as pre-diabetic stage. Every polycystic ovary patient is actually a pre-diabetic patient, and they have got that fatty liver issues also. So for my polycystic ovary patient, I used to give magnesium D3, as well as I used to get Pilates. And these two products really work wonders.
It works like wonder. It's like a miracle kind of product. If you prescribe this to any patient, right? We have the experience, right?
I'm very
Whoever the patient, they have got the result.
I'm very much happy with the efficacy of this product. This
Right.
Thank you.
Very good. Now, I guess Souvik will come to the screen.
You can continue with me. Souvik is coming back.
Yes.
Okay. Just.
Yes. Hello.
Good evening. So,
Very. Yes.
okay. So tell me about your experience with collagen, Souvik.
Yes. Basically, the role of collagen peptide is excellent, especially for Neutrova. Basically, if we have to deep inside the collagen peptide, we can understand that collagen peptide plays a important pivotal role in anti-aging, right? And basically, the people are nowadays more of stress, more of having stress, UV radiation exposure are there, and the more of chance of breakdown of collagen fiber. So, in case of synthesis of type 1 and type 2 collagen in the dermis layer, which causes wrinkle, right? The surging and loss of elasticity. So, collagen peptide derived from the hydrolyzed collagen are the small bioactive fragments in amino acid, especially glycine protein, right? So, our result of applying this Neutrova collagen is excellent. So, after using this for 3 months, so month on month, we are experimenting and we are taking the photos, we are having the experiences. So, we are keeping the videos as well, the skin elasticity. So, it is improving the day by day. The radiance also, you can discuss better as you are more practicing the skin. So if a person come to us aged more than 40 are asking for the age reversal, or they are keeping their age, they want to keep their age for long time. So for that reason, we are prescribing this one. It's very effective.
Yeah,
So
I
firstly,
guess that too we can suggest from the age of 25 or 30 years, right?
yes, absolutely. I was discussing earlier. Basically the factor is not only age. Age was earlier. Nowadays, in a very low age, they are taking most of the stresses and most of the UV radiances, and
Exactly.
so that their collagen depletion will be high. So that we can apply the collagen in the age of 20 itself. Previously, less than 40, we cannot, recommend collagen, right? So,
But up to 40, there will be already skin shagging or something. So after
right,
shagging and after wrinkles, I don't think so, there are much miracles. So if we started before 30, I think there will be a good maintenance, right?
absolutely, absolutely. And generally, range of collagen, the daily requirement of collagen, it should be around 2.5 to 10 grams per day. So, if it is more than 50, the people age is more than 50, we can recommend 10 gram or equivalent, which is twice the sachet of this Neutrova collagen. So if it is more than 50, then twice the sachet will be recommended. If it is the age is below 40 or around 20, so one sachet is sufficient, because minimum dose is 2.5 grams. Right. And we are providing 5 grams around. So
5.5
bioabsorption, 5.5 grams. So bioavailability and the available collagen, which is absorbable condition. So it will be much more recommended.
Hmm.
So, and we have to observe, for study shows that 8 weeks of continuous application of collagen.
Achha, just a minute. Souvik,
Yes.
you have got one question. Someone asked, Madam, sir, could you please repeat the amount or the doses of collagen? I guess 5 gram is the better
Five.
way. 5.
Yes. 5.5 gram. It is the average, right? Minimum collagen requirement is 2.5 grams to 10 grams per day, as per
But
recommendation guideline.
it depends on the age and the necessity.
And the necessity and the situation whichever is there. So people come to us, they are in marketing profession, sometimes they're in modeling, sometimes they're actresses, and they are spending early morning shoots, photo shoot from 5 a.m. to till 12 a.m. in the midnight. So they are having, they have to spend many times under the UV radiation, their stresses, and so many things are there, the makeups and all. So this require more than 5.5, so that we can recommend 2 sachets per day for them only. Okay, if they are out of this shoot, their actually doses should be monitored, and it can be altered person to person. A person whose photo shoot is there, or they are playing an international game, so that we can recommend 2 sachets on that special months. Okay, and in the specific days when they are in off session, like the season is not there, they are just on maintaining diet and all. They are maintaining their bodies. Only they are going to gym and all. Their skincare routine is regular, so that 1 sachet is sufficient for them.
That means if there is bone health, involved, then only,
Absolutely.
as I've told you at the beginning, in normal cases for everyone, we give 5 to 6 grams of collagen. But in case of any bone related things like sportsman or certain thing modeling, so then you can give the double dose, means around
Double
10
dose,
grams a
absolutely.
day. You can, and it's recommended you just give it in a two doses, like after lunch, after dinner. That is better rather than giving it in one shot. Right?
Yes, absolutely. And most interesting things, the collagen act as a bioactive messenger. Those peptides can bind to cell surface receptors. Cell surface receptors, as we have already discussed. So, intrinsic and deconizing domain receptor, like DDRS, which trigger the intercellular pathways which regulate inflammation. Okay. In the summarizing whole thing, it reduces the inflammation. Okay. Number one. And most of the people nowadays, they are exposing to the inflammation on a daily basis. Okay. So that we have to reduce their stress and inflammation on daily basis. And also cell migration and adhesion and fibroblast activity. Fibroblast activity means the dead cell removal or stress reducal. This is also important. And gene transcription for collagen production itself is very important. When you are applying collagen on daily basis for 3 months, his gene transcription also got changed.
Right.
Like body will understand the requirement of collagen, so that this can produce collagen on daily basis. So applying collagen is not only very important in the present scenario, is also very important in the future also. In the very future, in the gene transcription itself, which is a research base. Nowadays, we are having lots of studies in the outside India.
You're not audible, Souvik. Yeah, I guess now you're okay. So we have one question that is there any side effect of collagen? So I have said, I already told you, if you are using low molecular weight collagen to the patient, which is clinical, there will be no side effect. Side effects are mainly, bloating, constipation and all this. So, but they are for the high molecular weight collagen. As Nutrova is the low molecular weight collagen, me and Souvik, we have been using this collagen for many like more than a year. We have got very good result, isn't it, Souvik?
Yes. And also, yes, absolutely. And in for multiple patients, we are giving for the skincare, we are giving for the bone health regulation, for healing also.
Mm,
Post-operative cases we are giving, and it is
mm,
very important for injury recovery
mm.
for patients and who are some injury diet. The sportsman eventually having some injuries, and we have to recover is very fast. So that collagen is very much important in that diet. Okay, we used to recommend. And Nutrova
Someone
collagen
asked,
is
someone
uh,
asked, can it be given for
yes,
3 months and stop? So my suggestion is no.
yes, absolutely. We can recommend it for 3 months as per study because our studies, most of the studies are for 3 months. So after that also we are giving because it is a continuous process, right, Chaitanya?
Okay, so as we have shortage of time, we will answer all the questions, but we have one more
Okay.
panelist. Well, we have one more panelist. Please wait for him. Okay, we all are
Absolutely.
here to answer all the questions. We
Yes,
will
yes,
answer all the
absolutely.
questions. So now, Soumyendu, now we will talk to Soumyendu. Please come to the screen.
Chaitali, over here, my patient have joined. You know, the patient
Okay,
who is
okay,
delivering melatonin. So please
okay,
let her share her experience.
okay. Let her do.
Okay. So she will share now because I will be leaving. I am running short of time. So I will just share one or two experience. Chaitali,
Just.
do you
Do
want to
you
ask a specific question?
obviously like use of omega-3 or or its therapeutic uses of managing dyslipidemia, how omega-3 acid is help in the reverse of fatty acid, and
I
definitely the
am,
role of,
yes, continue.
and also one more question is role of magnesium in managing type 2 diabetes. Will you answer these two questions, please?
Yes. Just I will be briefing. I have already sitting with the product in my table. So you can see the fish oil and the magnesium. It's very relevant. Deblina Bishas, can you please mute yourself? Or
Yeah.
the host, can you please mute others? It is creating disturbance. So just a very basic thing. I will not go into the intricate science, Chaitali. So omega-3 is a very important unsaturated fatty acid, and it is very, if we consider it is a good fat that is actually
Right.
not produced by the body. In some way, we have to take it from the outside. Now the question comes that बहुत लोग है, बहुत dietitian से बहुत ज़्यादा seeds, nuts देते हैं. तो आप बहुत ज्यादा सीड्स नट्स लेके भी यू कैनॉट मीट अप द रिक्वायरमेंट, एंड इफ यू गिव 25-30 gram of chia seed, the person will not able to digest.
Right.
And if I say 10 gram of chia seed, it contains highest amount of omega-3, that is only 2 or 2.5 gram or 25 milligram of omega-3. That is also in the form of alpha linolenic acid. So the thing is, if you are taking the animal source, that is Chaitali madam was saying about the fish oil, so that fish are not mackerel, salmon, that are not readily available, and ILSA is also restricted for the 2 months. So the two things, eicosapentaenoic acid and docosahexaenoic acid, these are primarily available from the animal source, and only the alpha linolenic acid, which is available from the plant source. So ultimately, if you want to use as a therapeutic dose, I have used for two kind of patient. One is dyslipidemia, as you have asked. It tremendously have a good effect in managing triglyceride, overall cholesterol, but not so good in managing LDL. Obviously, LDL is a very slow moving particle, so you will not get the result within 1 or 2 months. But if you have a continuous use, I will not say that you will stop statin and start using omega. But in a course of time, just I am assuring that you may have to stop statin if you do a good lifestyle. That doctor will decide. आपका अगर पूरा ठीक हो जाएगा ना, आपका कोलेस्ट्रॉल पूरा नॉर्मल लेवल में है, सालों साल नॉर्मल में है, ब्लड प्रेशर नॉर्मल में है, so that you will get a Very, very, very good, right? Good. I am then coming to the second question. So the optimal dose is 1.5 to 3 gram per day for a healthy purpose. But when you are using for therapeutic purpose, so it will be 250 to 5, that is 5 gram. 250 means 250 milligram, that is 2.5 to 5 gram. তার মানে আমাদের কিন্তু অনেক হাই ডোজে ইউজ করতে হচ্ছে when we use it as a therapeutic dose. As per this, I am not saying, this American Heart Association is saying. So this is one thing about the omega. You will get very, very good result in reversing fatty liver disease. Fatty liver, you know, everybody know, those who are nutritionists, it doesn't have any medications. Even grade 3 fatty liver I have managed with omega-3, and it is having a tremendous good result.
Right.
Now I will ask a question to the audience. Can anyone say, does almond contain omega-3? Anyone from the audience? Yes or no?
Yes, sir.
Yes, sir.
Almond is having 0 omega-3. So conceptually আমরা এটা ভাবি যে মুঠো মুঠো almond দিয়ে দেবো and almond will have omega.
That
It
is
is
only walnut has got
only walnut in the nut family and the chia seed in the seed family of the highest. Even if you are give til, sada til, sesame seeds, it is only 0.3 to 0.4 gram of omega-3. It is not having huge amount of omega-3. So there obviously is a therapeutic dose. Almond doesn't have any omega-3 in it. It having omega-9 and omega-6 that are also required. Now coming to
what about flaxseed?
Flaxseed is next to
also having omega-3.
Next to chia seed. Flaxseed হচ্ছে chia seed এর পরে এটা হচ্ছে 2 gram in 10 gram, মানে 10 gram. If I am giving 10 gram 10 gram of flaxseed, so the absorption will be 2 gram of omega. That is also a good amount. Flaxseed omega-6 এটা is a good amount. Walnut is very good. Sesame is very good. Pumpkin seed is having omega-3. Sunflower seed doesn't have omega-3. It is having omega-6. So sometimes it can have inflammatory. If you take too much of omega-6, it will create inflammation in the body. It may be inflammatory, too much. But yes, almond having so many other
benefits
which are very, very helpful. So American Heart Association states for coronary heart disease and heart failure, omega-3 supplement is mandatory. And their research also suggested that is 4 gram or 4,000 mg per day, 1,000 to 4,000 mg per day as suggested by AHA. Now coming to Chaitali's second question, I have used that is that one, which one magnesium. It is very good. As Didi said, it is very good in sleep management. It is giving a sound sleep. Many Chaitali, many patients have stopped taking their regular sleeping pills.
Exactly, I did.
Alpenzolam every day. Another thing is, it is very like chromium. It is having a very good effect in managing type 2 diabetes, that is insulin resistance. Magnesium is having insulin sensitizing effect like chromium. It helps to regulate the central nervous system by affecting the nerve cells. It promotes relaxations of the neurotransmitter like GABA, which is a calming effect. And magnesium is having a very
GABA receptor.
GABA receptor is there, and it is very, very, that is 1,000 mg. And Chaitali madam has already said a minimum of vitamin D is there in the magnesium, which is
I think 600 international unit, I guess.
Yes, 600. So this is a very minimum. It is used for the absorption of the magnesium. It is very good for bone health, very good for sleep, very good for your diabetic patients, those who have insulin resistance.
And also it doesn't cause any dependency, right?
Doesn't cause any dependency. এই যে আমরা বলি, I am telling in Bengali for the sake of others, আমরা বলি 8 ঘন্টা ঘুমন। দিদিও বললো এই কথাটা, 8 ঘন্টা ঘুমানো মানে ওই ছটপট করে ঘুমানোকে 8 ঘন্টা ঘুমানো বলে না। Sound sleep. And after waking up, there is no drowsiness, nothing. Even my mother is taking. So I have a tremendously good result in my home also, omega-3 and magnesium. So that's all from my side. There is some patient waiting from Susmita this side. So
Yes, this is she's Srijoy Das. She's calling from Bangalore. I have given her Mela test, so I asked Srijoy. I request Srijoy if you can
ask
share
her
your
to
experience.
ask her to join through video call.
Video call, if it's possible to join through video call, it will be helpful. Srijoy.
yes.
Hello, Srijoy is there?
Srijoy, you have to.
Hi.
Now we can hear you, Srijoy. Yes.
Yes. So basically, I have been taking Melati's. It's more than a month, 1 month, 2 weeks to be very precise, and I have seen its effects actually. So Dr. Chatterjee, she prescribed me it's like a month ago, and I'm taking till today, and I have noticed a significant amount of changes in my body. I was not being able to reduce my weight. Now I can see the inches loss very clearly. All my dark patches on my neck, on my shoulder, on my like this part of my area, I can see each and every portion is getting cleared day by day. All the dark patches is gone. I'm not feeling drowsy throughout the day, which I used to feel earlier. So altogether, I'm actually getting a very, very, very good result. And thanks to Dr. Chatterjee for the same prescribing me.
And what about your blood sugar level?
So to be very honest, I'm just moving here and there, just between last 2-3 months. So I just settled down here, and even I'm just setting up my room right now. I couldn't get chance to check up the blood sugar level last month. So I might not say any random number. That won't be a good thing to say right now. So I would get back to Dr. Chatterjee with that, and you might get the information from her.
Okay.
Thank you, Madam
Thank you so much.
Srijoy, for sharing your experience. So
Thank you.
everybody will be very much enriched with your like experience. Susmita Di, thank you for making her
Thank you.
join today, and she has given us our time. So any question from the news before we wind up?
Now it is open for the questioning. So now you can ask, anyone can ask questions.
Anyone, you can switch on your video, unmute and ask. And
And
everybody, I am
ask
requesting,
questions.
please switch on your video. সবাইকে
Because,
যদি একসাথে
yes,
দেখা যায়, if we can
আমরা
see
চারজনেই অন আছি, আমাদের চারজনের থেকেই উত্তর পাওয়া যাবে। ঠিক আছে, just questionটা করতে হবে।
everybody.
Yeah, everyone. They can ask questions to us.
Vidisha, you have put a question in the chat box. Can you please unmute and ask the question?
Sir, I want to know the doses of omega-3.
It comes in a box. So you just need to prescribe one capsule.
This is one capsule. This is EPA is 45 and DHA is 38 gram, and you have to take one capsule. This is
One
per 100.
capsule,
This is 100 grams.
after lunch or breakfast or dinner, just one capsule a day, right?
So one capsule, Vidisha, you are getting 658 mg, 300 mg of EPA and 250 mg of DHA. This is the optimal dose, and we are not exceeding the dose. Even I have prescribed to my patient only one capsule.
Yeah,
for my
obviously one capsule, not more than one.
Fatty liver. And আমি যে স্টাডিটা বললাম সেটাতেও দেখবে লেখা আছে 400 mg দেওয়ার কথা, even the heart function. Okay, চলো next question.
Anyone?
Ma'am, yes, ma'am. I'm Jayashree.
Okay.
Ma'am, I have a question regarding the this fish oil. There are so many patients, those who are pregnant or lactating, they are losing their hair, and they're complaining the extreme hair loss. Can we give it to those patients?
See, Kerastrength has no effect with placenta, with the baby or with the fetus. So Kerastrength can be given. Okay, Kerastrength can be given even, but if you are asking me about collagen, so I cannot tell you no. Don't give collagen during pregnancy.
Okay, sure.
Jayashree, I will ask Mr. Sushobhan to share the entire product portfolio in your WhatsApp group so that you can go through it. And then Mr. Sushobhan is there as in the WhatsApp group. He is the admin and he is the manager for this company. So anybody who have joined today, if you need to know about the product or if you want for you or any patient, Mr. Sushobhan is there to guide you.
Yeah.
Right, Mr. Sushobhan? Yeah. Okay.
Yes, sir, definitely. After this meeting, we share the entire product.
Just a minute. No, you can't give Kerastrength to the complete alopecia patient. So for in case of, already hairs are gone, there are no follicles. I don't think so that
No,
Kerastrength can
Kerastrength will not work. Right.
make any difference to it. That is the point. So if there are no follicles, so the patient has to go for hair transplant, and the transplant expert will understand. There we can't help them. Next question. Is there anyone wants to ask something? Yeah.
Ma'am, I have a question that can we give any form of collagen to the constipation patients, like who have the constipation?
Low molecular weight collagen you can give, which is to be clinical product. There are certain other brands who is having all this collagen and all, but patient will get bloating, constipation, and indigestion. So low molecular weight clinical collagen you need to suggest. So Nutrova is the clinical collagen, low molecular weight, and has they have studies and everything, so that you can suggest to your patients. As me, Susmita Di, Shushobon, not Shushobon, Souvik, Soumyendu, all four of us, we are getting very good results. So according to our experience, we can ask you to, if you want to give the Nutrova collagen. Okay. Shushobon is their manager who is here. So you can ping him. He can tell you more about it. Okay. Any more questions?
I think there is no more questions.
No more questions. I know it's Sunday. Everyone has to go out. So definitely, it's almost
And somebody is already out.
some people are already out. So I guess, Shushobon, now I think we should complete all this webinar here. Okay.
Yes, sure. One thing I like to tell you that our doctor is there. Actually, Dr. Meghna is there. Meghna, are you there?
Yes, I'm here.
Okay. Meghna, anything you like to add on Nutrova product? Like, actually, you were on the clinical team that time, clinical trials team that time. So, anything you like to add on Nutrova background, like what are the products and how it become so great for the patient? Just any experience or anything.
So I had already briefed in the beginning of the talk that we do clinical studies on all of our products, and now we are looking to get some before and after pictures from doctors and dietitians who would like to participate in this. So you can reach out to me for anything if you're interested. I'm going to leave my email address on the chat here.
Okay. Then, ma'am, I think we are going to close the webinar because I think there is no further question.
I think we need to, finish this webinar over here, as it is Sunday, and we have been logged in for 2 hours. So it is a very good interaction with everyone. I guess everyone is having a very good experience as well. So from my end, I'm just going to I'm going to out. Bye then.
And first of all, thanks from Nutrova side, all the doctors who are joining in this webinar. And thanks to Chaitali ma'am, thanks Dr. Soumyendu and Dr. Souvik, and of course Dr.
Okay.
So thanks for your
Thank you so much.
Thank you.
So thank you very much.
Thank you. Thank you, everyone.